This video is part 2 of my discussion of Beautiful Boy, directed by Felix van Groningen from 2018. The film allows you to think, at least briefly, about what kind of other challenges Nick is facing that are associated with, maybe predictive of, his experience of addiction, either as a consequence of addiction or as something that may have precipitated it. In my reflection questions, I asked you to think about the conversation between Nick and his parents in the second rehab, and whether or not Nick appears to have other kinds of mental health issues that he's experiencing at the same time. In the lingo of psychopathology, we talk about comorbid conditions. So these are conditions that are often diagnosed simultaneously with addiction. It's not uncommon for people to, in addition to having addiction to alcohol or to drugs, to also experience depression and anxiety, for example, or to have even more serious mental illnesses such as bipolar disorder or schizophrenia. Now, I'm not suggesting that there is a causal relationship between the two, but there is a fair amount of research that suggests a correlation. And what isn't clear is, which comes first, the experience of the comorbid condition, for example, depression or anxiety, or the addiction. They likely influence one another. Now, one of the things that attracted Chalamet to the role was that, and remember that from part 1, I mentioned that he has in his own experiences with friends who became addicted to drugs and other substances, he argues that there's this misconception that addicts are experiencing all this euphoric happiness when they're high. And his experience, not his direct experience as a user, but his experience with the people that he knew, was that these were people who often wanted to shut off feeling, who wanted to stop feeling intense emotion, and either snuff it out or override it with some other experience. So he argues that it's a misconception that people who are using drugs are experiencing all these joyful emotions, these heightened experiences, when in fact that may be just clearly a misrepresentation. That what people are doing, and many of you who read Chasing the High, this is something the author of that book also wrote about, was that you may have had some initial experiences of euphoric highs, but once addiction sets in, you're just trying to keep yourself from going into withdrawal, and that's part of what Chalamet is trying to point out here with that comment. So I bring up comorbid conditions because for many people with addiction, treatment is limited in its capacity to allow people to have stable rehabilitation, because their other conditions, their depression, for example, their anxiety, their PTSD, their bipolar disorder, if it is separated out and not dealt with, but the only focus of treatment is the addiction, that those problems may precipitate relapse. So what makes more sense is if you take a more comprehensive approach to helping people to manage their other mental health issues in a comprehensive way, and do that simultaneous with and integrated with treatment for addiction. And this becomes complicated in kind of the 12-step treatment world, if you are a person, let's say you've been diagnosed with bipolar disorder and you also have a substance abuse disorder, in the 12-step world, there tends to be pressure for people not to take any kind of medication that is mood altering. Well, that becomes problematic for someone who has, say, schizophrenia or bipolar disorder or depression, where some of the most powerful tools that are out there for treating those conditions are medications that alter mood. So in the world of addiction therapy, there's often these dual pressures that people can face, where they're getting one message, which is treat your depression, treat your anxiety, treat your PTSD, and maybe medication is a part of that, but then the other voices are saying that's just another crutch, that's just another addiction, and that can be very problematic for people. There's also in some segments of the addiction world, there are people who say that the only way that you can manage addiction is by identifying it as this permanent aspect of who you are, that you are and will always be an addict. And that's kind of a part of the 12-step ethos. Whereas in the mental health community, in the medical community, the tendency is to identify addiction as a disease or as an illness that has multiple layers and components, but is not woven into the fabric of who you are as a person. So there are some of these intersecting, competing ways of thinking about addiction that can often catch families and individuals in the middle. One of my reflection questions that I proposed to you as we watched the film, after Nick goes to college, he is, he's got some freedom, but he's also got some, growing stresses and is exposed to some triggers. One of the more authentic components of the film is the fact that here you have a young person just moving into adulthood, and probably many of you can identify with the pressures of just being in college life, meeting people, having romances, and meeting families, and so on. For Nick, meeting his girlfriend's family becomes a trigger that he can't overcome. So, he's shown in the house, he's meeting the family, and it appears to, at least this is the filmmaker's intent, to trigger his anxiety and a bit of his desperation. And, he goes into the medicine cabinet and finds what you're led to believe are opiates that he takes. And one of the good things about the film is that the filmmaker, and the writers who are taking the starting point, the shared memoirs of the father and the son, is that they do contextualize who Nick is and who his family is. You have this blended family. You have mom, you have dad and stepmom. You also have Nick's mother. And then you have the two little kids who are David and his wife's children. He is shown having a very loving relationship with his younger siblings, but you can also see the fraught nature of that connection, given Nick's difficulties with actively using drugs. So the filmmaker and the writers, and I believe in the memoirs it comes through as well, that you can't just have a one-dimensional character and say this is an addict. He is a person, Nick, who has a life, who has a family, who has a context that's very rich and multifaceted. He also has an addiction. So it's important to see that. In lots of film and television shows, you aren't given that context. You aren't allowed to kind of see that this is a person who actually has much more rich background. I mentioned in part one of my discussion of Beautiful Boy an article written by Sam Lansky in Time, and one thing he says is that he kept circling back to the same point, how hard it is to talk about this movie and the things in it. This movie does such a fine job at showing how addiction shatters family, it almost spooks you into reverent silence. So one of the things that Lansky found powerful about the film is that you are built this context. These are people who love each other, who care for each other. There are children who are looking up to their older brother, but they're scared for him and they don't understand what's happening. So when I ask you why is it important to show the positive nature of their relationship, including the flashback scenes to his early childhood, it's because there is this stigmatizing belief that addicts only come from fractured, dysfunctional families, from bad people, basically, and overwhelmingly bad circumstances. When addiction is an equal opportunity problem, it happens even in the circumstances of love and affection and care. Now, Steve Carell, when he was interviewed about the film, he stated, clearly it's important to us, or else we wouldn't have done it, but when you get to the question, why should people see this film, how do you even respond to that? Because it's compelling and emotionally resonant. And what Carell is getting at there is, it's an intensely human story of the pain and frustration of what addiction does to whole families. So he doesn't want people to say, I want to go see this movie because it's compelling and emotional. No, he wants people to go see the movie because it's honest. And that's really what they were looking for in the film. Now, I ask you, why is it important to show this normal, even privileged family background? As I said before, one of the tendencies is to stigmatize people who come from, who have addiction as coming from poverty, as coming from criminality, as coming from immoral family contexts, and or the very, very bad behavior of others. And that's just simply not the case. So it's extraordinarily important that the filmmakers chose not to follow that path. Now, I've asked this question before in reference to other films. We started out the semester with Joker, and there was a journal that was a very pivotal piece of the story. We watched Girl Interrupted, and the journal that Susanna keeps is a pivotal part of the story, at least for her character development. We again see an artistic young man who exposes his demons in his writing and in his sketches. In that journal, and you're shown several scenes where he is writing in this journal or drawing in this journal. You're not given a lot of images of the journal itself, but what you do see is disturbing. And I think part of why writers are attracted to giving us snapshots of people's journals is because we have this belief that journaling is a place for private thoughts, for the things that terrify us, that give us the greatest joy. And they also sometimes are the hidden places for our talents as well. So when David sees Nick's journal, it's a deeply terrifying, but also really sad revelation for him. Some of the things that his son is saying are terrifying, but there's also this deep sadness of lost potential, because here is a person who is deeply sensitive and talented, but his addiction has twisted that into this stalled development. Now, one of the important themes, although I wish it had been developed more intentionally by the filmmakers, David Sheff in real life was an investigative reporter, and he kind of took his skills as an investigative reporter and put them to work to try and understand his son's situation. So the film opens with David having this conversation with Dr. Brown, played by Timothy Hutton, and then it comes back to that scene later in the film. So you're kind of given this preview of the importance of this conversation with Dr. Brown, where David is just really desperate to understand what addiction is doing to Nick's brain and mind. Now, in addiction films, we don't usually get some kind of mini lecture on the neurobiology of addiction. So, as a psychologist, I kind of went, okay, I need another 20 minutes of that lecture. But knowing that audiences don't have the patience for that, they just don't have the time for it. But one of the things that you should keep in mind about, why would the writers want to include this? It was probably a big part of Sheff's memoir to have this conversation with an expert on addiction to operationalize the whole thing for himself. Why put it in the film? Well, right now we are in the pendulum swing of explaining things like addiction. We're at a moment historically in American culture where we tend to preference biological explanations and to use them more readily for our kind of causal narratives for understanding what goes on with us. So in a way, what the filmmaker is doing by really positioning this conversation with Dr. Brown at 2 points in the film is to kind of give us that cultural angle of the neurobiological explanation of addiction, or the neurobiological context of addiction might be more accurate, because that's kind of where we are as a culture as well. Now, from David's point of view, he also wants to know, is there any coming back from this? So he really wants to find out, has my son damaged his brain so permanently that there is no coming back? Will he always be an addict? Will he ever be whole again? And that's a question that's difficult to answer, given the current science that we have available to us. There was also, given that Nick Sheff in real life, his drug addiction was primarily methamphetamine, there was a lot of discourse in the 1990s and the early 2000s about permanent or relatively permanent changes in the brain that are caused by the use of amphetamine type drugs. There started to be some conversation about that through the 1990s, 80s and 90s, in conversations about cocaine, and then in the 2000s, as people were looking at long-term effects of meth. There was a real common kind of cultural narrative that emerged across the 2000s that suggested once you start down the meth pathway, that your brain is irrevocably changed. So I think what they're in part attempting to do in the film is to contextualize that sentiment within American culture. And one of the important things about the film, and I think this is evident in Lansky's Time article, where he's reviewing it, you do get some real tense conflict moments. It is a rare thing when families do not have exactly these kinds of conflicts. When they have a loved one who has an addiction, there are so many things that you want to do as a parent, that and every parent is going to have different thoughts that they have about what's right to do. So they have conflict. This is why addiction is so difficult for families. Now, as I mentioned on the previous slide, David's coping mechanism is to investigate the issue, and to run quick. He's a quick reactor. He flies from one side of the country to the next. He tries to do whatever it takes to keep his kids safe. Karen is a little more thoughtful, more emotional in her attempts, but they're both just torn to shreds by this. So David, he really takes as a coping mechanism his investigative reporter skills to study it, and then he starts to write about it. He starts to put together his experiences, his story. And that became, what you're shown on screen is what became the book, Beautiful Boy, the memoir that he wrote. They also show you really unflinchingly the kind of living grief that people who have a loved one with addiction face. And this is something that we just don't get shown enough. And it becomes a part of the shame and stigma that family members often feel, that they have this unrecognized grieving process where you don't have, if you have a family member, a close friend of mine has an adult son who has an addiction to methamphetamine, and one conversation we had, she said, the hardest thing is that, if my son had cancer, if my son had some other physical illness, my friends would be there to support me. They would, bring me meals, or they would come see him in the hospital, or whatever. And I can't talk about grieving the loss of the son that I used to know because other people don't want to hear it, or they think I'm to blame. So there's this unresponded to grief and loss that family members report as being just really devastating. And that's, the societal stigma that's associated with addiction really affects not just the person with the addiction, but everybody else in their atmosphere, because their friends and family may reject them. Their friends and family may say, your loved one has addiction. That's an illness that doesn't deserve my attention. So when you see at the support meeting the parent whose daughter died, she says she's been grieving for years. That's a real, honest experience that many parents and family members of people with addiction share. And in your reflection questions, I really wanted you to think about that a little bit in terms of David and Karen and Vicky's shared experiences. Now I ask you the question that I ask after all of our films, where would you put this film in terms of the stigmatizing elements of the film? I'll go back to the Lansky article one more time. Lansky says, so of course it's hard to talk about, because when you talk about addiction, there are maddeningly no satisfying answers. And even I, after many years clean and sober, never know exactly what to say about it, which is both the challenge and the triumph of the film. It's not a movie that claims, Hollywood ending and all, that the love of a parent is enough to save a sick kid, but it's a powerful reminder that it's worth trying. He concludes his article by saying, on the way home, I'll call my dad. So there are clear benefits to the film. As I mentioned in part one of my lecture, there are challenges. This is yet another story about addiction that features privileged white people who are very well off and can afford treatment. So in a way, it's a very rarefied story that is not typical of stories of addiction from many points of view. On the whole, there are positives to the film, really digging down in the weeds of the impact of addiction on an entire family system, where it could, where the world of addiction film would benefit is if we really started to tease apart those other intersecting communities, where addiction just also wreaks havoc. You know, addiction is not a white upper class disease. It's a problem for all kinds of people from all walks of life.